Hello and welcome to our session. I'm just going to give a few seconds for people to join us. We'll wait just a minute or two for everyone to be able to connect. All right. So I think we will kind of slowly get started as we wait for people to join us today. I'm going to just bring up the PowerPoint presentation. Just give me a second to load this. All right, here we go. So first of all, I'd like to welcome you to our session today. As we kind of get going, I'll just give you a couple kind of housekeeping points about how we'll run the session today. So for those of you who have attended other sessions as part of the conference, you'll be able to see kind of to the right of this screen, there are some features that you can use throughout. So there's the live Q&A part. We would ask that you use this to kind of ask questions, pose questions about the presentation throughout. We will be kind of taking some breaks to address those questions as we go. There's also a discussion forum feature, which you are also more than welcome to use. This is more for kind of maybe less questions, but comments that you might have that other participants may also like to engage with. So we will be keeping more of kind of an eye on the Q&A, but feel free to use that discussion as well. This is set up as kind of a more traditional Zoom meeting, so you will have the opportunity to speak up and participate in that way, but we would ask that you please keep your microphones off when you don't need to be speaking. So today in our presentation, we're going to be primarily sharing our experiences around documentary making and making a documentary about research. This presentation today, originally we had designed it to be a very interactive session where you would be, really hands-on, going through exercises and kind of testing this out. But in adapting it to the online format, we've had to sacrifice a bit of that interactivity. Hopefully, we will be able to still have a bit of discussion. This workshop, we did a version of this workshop at Jim University about 2 years ago, and today's will be shorter and less interactive, but it does kind of cover some of the same content there. So our 4 objectives today. First, we want to kind of help you to think about different opportunities to use videography in research. We hope that you'll come away from this session understanding what the considerations are at different stages of making a documentary. We hope you'll be able to think through your role in making a research documentary and kind of what your contribution might be, perhaps as a researcher. And then we'll go through kind of some of the ways that we've used video products in research dissemination and how we've integrated that. Today we have, unfortunately, one of the presenters is unable to join us due to internet and connectivity issues, but myself and Abebe Mamo from Jim University will be presenting. So our session will kind of be in 4 parts, and we'll pause after each of the parts to go through any questions or to have discussions. We want to hear your thoughts and kind of your reflections. If any of you do have experience making or being part of videography projects, we very much welcome your expertise as well. The 3 modules that following introductions we're going to present are content that we've developed alongside a filmmaker. So we worked closely with a Canadian filmmaker by the name of Nicholas Castell. And when we were originally preparing this workshop for its first iteration at Jim University, he and I kind of worked quite closely in thinking through the content in each of the modules. So the first part of the introduction, we will introduce ourselves. We will ask you to introduce yourself. And then we'll just give you kind of a background and context of our research. Module 1 will cover what we're calling pre-production. So this is kind of when making a documentary, everything that happens up until the time when we essentially start filming the documentaries. So the planning, finding funding, those types of things we'll go through in some detail in Module 1. Module 2 is where my colleague Abebe will give us some more insights into doing the filming. So what that looks like, what kind of happens out in the field, what issues we ran into and experiences we had there. And then Module 3 will cover kind of 2 aspects of the post-production. So, what's coming in from the field and getting that footage, what happens then in terms of, the editing and the post-production of the video. But then also, the dissemination, screening the video and sharing those products. So that's the outline for our session. Today, as I mentioned, we were meant to have 3 facilitators. Unfortunately, Professor Marankar in the middle is unable to join us. So I will be speaking to kind of the notes that he had talked about for his slides. On the left is Abebe Mamo. Abebe, would you like to jump in and introduce yourself? Are you able to turn on your microphone?
Thank you, Nicole. I am Abebe Mamo from Jimma University, Ethiopia. I will join you on the production part.
Great, thanks Abebe. And Abebe, as he said, is from Jimma University. He's working on a PhD related to the research that we're going to talk about today. Myself, I'm joining from Ottawa, Canada. I've just finished my PhD at the University of Ottawa, and I have a background in health equity and also in health communications. And so that's kind of where some of this motivation to make the video and think about ways to enhance our research dissemination strategy came from. Professor Marankar, who would have joined us, maybe he'll manage to connect, so I'll just mention his background. He is a medical anthropologist, originally from India, but he has been at Jim University for the past 10-15 years, and so is very involved with the work there. At this point, we would like to, I know there's a few of you in here and this session is being recorded, but I would like to invite any participants that are willing to do so to just let us know who you are, where you're from, why you're here, if there's anything in particular that you're hoping to get out of this session. So I'll give you a couple seconds. If you'd like to unmute and say a few words, you'd be very welcome to.
Hello, can I go?
Sure, yeah.
My name is Professor Stephen Okeo. I am joining in from Kisumu in Kenya. I'm a public health and reproductive health specialist. I teach and I do clinical work and research, and clearly documentation is one of the things that I do. So I hope that learning more about documentation can help in my teaching and in my research, and of course in a dissemination of the work that I do. Thank you very much.
Great, thank you very much. All right, is there anyone else? Okay, we'll continue on then. If you would like to speak up, anyone else at a later point, you're very welcome to do so. So the next few slides are going to be an introduction to our research project. I thought it was important just to give you a bit of background on kind of what we're looking at, where we're starting from, and kind of where we were at when we decided to make this documentary. So Abebe and I have been working on the Safe Motherhood project over the last 5 years. So this is a project that is funded by the Canadian government through an initiative called IMCHA, or Innovating for Maternal and Child Health in Africa. And this is a joint initiative funded by International Development Research Centre, the Canadian Institutes of Health Research, and Global Affairs Canada. And this kind of broader initiative funds about 20 projects in different countries in Africa, all focused on maternal and child health. So our project is based in Ethiopia, in Jimma. There are members of the research team from Jimma University, from the University of Ottawa, as well as the Jimma Zonal Health Office. So, one of the kind of important aspects of this initiative is to really involve policymakers also in all aspects of this research. And our study asks our kind of guiding question, what existing and new interventions designed to remove barriers to safe motherhood options contribute to a reduction in maternal and child mortality and morbidity. So our project is based in rural parts of Jimma Zone and looking at specifically 2 interventions, which I'll tell you about a bit. Our timeline, we started in September 2015, and due to COVID, the time frame has been pushed back a little bit, but we will be wrapping up kind of this spring. So this shows our study location, which is in Jimma Zone, Oromia. And our project focuses on rural and remote areas within Jimma Zone. We have 3 different areas where we're working. So Goma, Kursa, and Sega Chikorsa. They're all kind of located with some proximity to Jimma town, where the university is based, which is about, I believe, 100,000 people. And our project is kind of designed around 24 primary healthcare units, which are either receiving our first intervention, our first and second intervention, or our control arms that are not receiving any intervention, just standard care. So this part of Jimma Zone is kind of famous for coffee growing, especially in Goma. Goma itself is kind of relatively affluent area. There's a lot of motorbikes, and relative to other places in the area, there's a lot of coffee sales. Kursa and Zagachakorsa are also very predominantly rural areas. There's very lush vegetation, a lot of hills. The population is fairly sparse, so people are really kind of spread out over these vast distances. And we know that there are, road access can kind of, often be an issue in terms of connecting people with health services. Baby, did you have anything that you wanted to kind of add about the study location?
Okay, Nick, you already mentioned it very much. As you said, Goma is a highly coffee cultivating area, and Karsa is a sparsely populated area, and Sakkachakorsa, it looks like very closer to Jimma town and has access to road, but some areas very difficult to access even. They are very remote and it's very gorgeous and some things are there. So you mentioned it very well. Thank you.
Yeah, great. And you'll have the opportunity to see some visuals of these areas when a bit later in the presentation, when we do show some of the footage that we took.
Okay.
So our research project had two main interventions that we were looking at. So the first intervention was upgrading maternity waiting areas. So maternity waiting areas are residences located next to health facilities where women can go in the late stages of pregnancy. The idea is that they are then kind of, women who might have quite a long journey or barriers to get to the health facility can essentially come early. They can stay in these MWAs and kind of be well situated when the time comes to give birth. They're then able to receive skilled care very easily. In Jimma, when we started our project, this was something that was of interest to the Ministry of Health, to the government. They were looking at, building an evidence base around these residences. So we, our first intervention was looking to increase skilled birth attendance and improve access to perinatal care by upgrading these areas, making them really appealing to women. So our study provided a lot of material goods to the MWAs, helped to kind of streamline the functioning of them. And so we were hoping to make them very kind of, enticing to women and just working really well. Our second intervention was information, education, and communication workshops. So here we targeted three groups. So the first is health extension workers, who are community health workers that have, really amazing networks kind of within rural areas. And so we did some training with them, and then they actually kind of co-facilitated subsequent workshops with religious leaders and Women Development Army. And the Women Development Army are kind of champions for different health issues within the community. They work at really the most grassroots level. And so these workshops, we were trying to generate awareness around maternal and newborn child health topics. This was a space to talk about barriers and enablers with respect to service use, to identify strategies to overcome barriers, and really just to encourage increased use of maternal child health services, including the MWAs. And so these workshops, they were done kind of in four parts, looking at, pre-pregnancy, during delivery, post-pregnancy, and then community mobilization. So our study kind of kicked off in late parts of 2015. We did our first data collection in 2016 in May and June. We did what we call a rapid assessment. So we went out and talked to most of the major stakeholder groups that were going to be targeted or involved somehow in our research project. And we were able to get kind of a sense of how to design and target the interventions to be meaningful to those groups. Our project, thanks in large part to Professor Marankar, has really strong connections with high-level policymakers. And we have what we call a National Advisory Committee, which has met almost yearly throughout the project. And they're really important to provide kind of guidance and direction. We share our results as they're coming in, and we get feedback from these individuals about kind of how to move forward to the next stage of the project. So our first National Advisory Committee meeting was held shortly after that initial rapid assessment study. We then went and did our very large baseline qualitative and quantitative data collection later in that year, and then began to roll out these two interventions. So the MWA upgrades and the workshops were rolled out in 2017. And then this is kind of where this video documentary project is situated. So the interventions have been rolled out. They've been working for a year and a half or so, and then we went in. We did this video documentary. Shortly after that, we had another meeting with the National Advisory Committee, and then we started our end-line data collection. And our final National Advisory Committee meeting will be held later this month. So that documentary piece is really kind of situated midway through our research, which will kind of we'll come back to this later in the presentation. So that is the end of the first module. I want to give Abebe a chance to kind of fill in any blanks that I might have missed. I would also welcome if anyone does have any questions or comments, thoughts from the participants. Please feel free to speak up now as well.
That's nice, Nicole. You can go on.
Can I ask a question?
Sure.
In terms of funding the, okay, I could have missed it. Who owns the waiting homes and how is it paid for, especially thinking about it in the long-term sustainability issue?
Thank you. Abebe, would you like to take this one?
Okay, thank you very much for the question. For sustainability issue, we will proceed on production part again. The good thing is the training was given for all colleges in the university. From all colleges, we recruited 2 individuals from all college. We have 8 colleges. From these colleges, we recruited 2 individuals, including from our department. A lot of people are participated on this. For the sustainability issue, we have a lot of trainees. That means we have a lot of trainees. For materials, also the materials that we used on the field for production, for filming, everything they donated for the university. So at this time, we can handle everything here without Nicole or Nicolas, something else. So that's how they started and how they complete the videography here in Europe. Thank you.
And are you able, Abebe, to speak to the maternity? I think the question was around the maternity waiting homes.
Yes, that I didn't understand.
The question is who owns the waiting homes? Formally, informally, administratively, legally.
Yeah, that's the government of Ministry of Health. Ministry of Health of Ethiopia is owned this. It started in 1992, I think. So that's already the health system of the government of Ethiopia.
Okay.
And my understanding is that there are contributions that the community also makes in terms of donating food and some services to ensure that they're kind of able to be sustained in the community. And the maternity waiting homes are free for women to use. There's no kind of upfront cost for them to stay there. Okay, I'm just checking the live Q&A. I don't see any other questions. So we will go on to the first module. So in this part of the presentation, we're going to, it will kind of be the most structured part of our session today. We will draw a lot on our expertise, or sorry, our experiences and our approaches that we used when we filmed our documentary. And as I mentioned at the beginning, this is an approach that we really developed kind of in collaboration with the filmmaker and between the two universities. So again, I will kind of pause for comments at the end of the module, but we'll go through different types of videography projects and kind of think about what they might be used for. I'll then introduce you to the documentary treatment, and we'll talk through kind of each section of that document and considerations that can go into that. We'll spend a bit of time on target audiences, what kind of different target audiences might entail in terms of planning a documentary, then go through budgets and funding, crew and gear, as well as other issues. So again, this kind of covers all of the planning stages up until starting to film the documentary. So we kind of wanted to describe 3 cases where you might use documentary or videography. The first one is as a research method. So using video as a research method involves a rigorous research process. There are different methodologies that can be used, and the aim here is really to generate new knowledge. So this would be things like photo voice, video diaries, or video content analysis. Here, participants, like in any type of research, are typically required to give informed ethical consent. There are methodologies that have been developed, discussed in the literature, and there's a type, an approach to analysis that is systematic. And so using videography as a research method is a way to generate findings that will carry some amount of scientific credibility or weight if the methodology is rigorous. So this was one kind of box that we could say that video could be used in research. Secondly, which is how we used video is as a tool to disseminate findings. So here we're really starting with an evidence base, or starting with some type of research findings, and we're using videography to share those results. So here the purpose of using video is oriented towards the interest of the viewers. So this is things like documentaries, presentations, public service announcements. And for this type of videography use, it's generally you start with kind of an evidence base and a comprehensive understanding of the subject matter. And then a third type of use of video is what we kind of thought of as to be more cinematic or social. So this is using video for something that's fun or creative. Generally, these type of outputs tend to be more accessible to the general public. So these are things like films, commercials, online videos, and they kind of grow out of an interesting idea or, perhaps a marketing kind of goal. So this gives you, kind of an overview of how, in a broad sense, video could be used for different purposes. And today we're really going to focus on number 2, disseminating findings. But some of the considerations that we talk through do have relevance for the other uses of videography. So when I kind of came up with this idea to maybe use video in our research project, I really wasn't sure kind of where to even start. I had kind of put out some feelers in our research team. Is this something that people are maybe interested in? And, people said, yes, it sounds like it could enhance the project. But in terms of, sitting down to kind of chart out this initiative, I was a bit at a loss. So fortunately, I have a good friend who has been involved with making documentaries in the past. And so I called her up and said, Karen, can you point me in the right direction? She said, the first thing that you really need is a treatment. So a treatment is a guiding document that kind of lays out in a very concise way your ideas for planning a documentary. Treatments are something that are kind of evolving. They can be adapted and developed as your project progresses. So they're a bit of, we might say, a living document that can change and adapt as you go. But I found that this was really, really helpful to have, from I pretty much started from day one and built this as we went. And it came in handy a lot throughout the process. One way that I use the treatment, apart from just our own kind of internal use, was I would, when I approach funders, I would give them a copy of this document, and they were able to see very quickly, what our project was, what we had in mind, and a bit of information. So this was the document that we kind of created for our project. This represents a bit of a combination of different treatments that I found online, and kind of took bits and pieces from different documents and resources that I encountered. So I've actually put a copy of this in the handouts part of the portal. So you're welcome to download it. It's a Word document, so you can add items or delete items if you'd like to use this for projects that you're working on. So here we have a series of just different headings, and you can kind of fill in information to outline what your documentary will look like. So we'll be going through kind of for the next several minutes different parts of this document and the considerations, what to think through for each. I do want to just draw attention initially to this first part about the length of the video, because this is really important. I think this was probably one of the first things that we thought through when deciding to make a documentary about our project. I received, kind of talking through this project, a lot of different opinions and advice about what length of video to make. So, and I think, they're all valid. There wasn't one answer, but we had to really think through what would work best for us. So, there were some people who advised to make very short videos with targeted messages. These, shorter videos are more appropriate to post on social media, to give to decision makers who might not have, a longer amount of time to sit down and watch a video. They want something that's really to the point and quick. A shorter video can be punchier. It can have typically, fewer messages that are more directed. But then on the other hand, longer videos allow for more of a deep dive into the subject. So you can really illustrate some of the complexities around your research and the research context. And a longer video, maybe isn't as suited for media such, social media platforms. It requires more of a dedicated audience. So someone who's willing to kind of sit down and spend the time and watch it. So I think, in thinking through the target length of the video, it kind of sets the pace for a lot of other decisions that you'll be looking at as you go. So this was a really good point to just start thinking about what is our desired impact from using video. And then, also thinking through where in your research project are you? Are you at the point where you have those key messages that you're ready to give to decision makers? Or, like us, we were kind of midpoint through the research. So we ultimately decided to go with a 20-minute documentary, which would be considered kind of a short film, but, certainly longer than something that you would, post on social media and expect people to watch on their phones. So that ended up being kind of where we decided to go. But this was initially kind of one of the first decisions that we kind of had to think through. So we're just going to move on through some parts of this document. So in kind of, starting at the early stages of planning the project, if you're making a documentary about a research project, for us, we found it really helpful to just think through what is our research, what are our findings, what story do we want to tell? And so this here is a ecological model that we had built out of some of our preliminary data. And this was actually published in a paper. It was, peer reviewed and kind of developed more. So we thought that this was a good place to start in terms of the research evidence. And, I kind of, when I talk about our approach, say we started with the research, we came back to the research, and then, we use this continually to guide the documentary. So this really helped us to make sure that we were, presenting the findings of our research and kind of staying on track. I think as researchers, we really want to be accountable for information that we put out into the world. And so having, the evidence base as a starting point became really important. The first parts of that documentary treatment are there to provide some background about the context and the research that will then guide how the documentary develops. So in our project, we've talked a bit about the research project itself. So our top line, as an example, was that a priority of the Ethiopian health sector is to ensure that pregnant women from rural and remote areas have safe deliveries. The Safe Motherhood Research Project is working to improve access to essential care and address cultural barriers to use. So this is, just a really, concise, overview of where we're coming from. We included a few facts on here to give, a bit of more information about, like this is what's happening. This is what we're going to be capturing in the documentary. So moving on, the next part of the treatment asks about kind of the characters. So here, when planning out a documentary, it's good to think about, which characters, first of all, who will you have access to? Are the people okay with having their stories shared? And where will you, as filmmakers and researchers, need to fill in blanks? So, planning out our documentary, we knew that we wanted to, of course, include women from our study area that had accessed, or in some cases had decided not to access health services, and we wanted to share their stories. We also wanted to include people from our research project. So, the researchers, what were their perspectives? What were they aiming to do with the project? And then we also included some of the decision makers, people at the government health offices. We talked to midwives and husbands, family members, people in the community. So we were kind of building up, trying to really illustrate what was happening in terms of maternal and child health in these areas. When thinking about which characters you want to include, there are a few logistical considerations. So, what language do they speak? Will their words have to be translated? Permissions was a big thing. So, are people going to agree to participate in the video, to be filmed? Did they have expectations around compensation? So here, like if you're asking someone to spend days or weeks with you doing filming, there might be some expectation that they would like to be compensated for their time. And then, in our case, there were some considerations around timing, just because some of our characters were in the late stages of pregnancy. So, kind of being aware of, the timing around that. If we're planning our video in, 3 months out of when we're going to do the filming, we want to make sure that our characters account for where they're going to be at in their pregnancy. And so for us, recruiting characters or finding people to be in the documentary, we really relied a lot on the strong connections that we had built in the community. So I think Abebe will speak a bit more to this in the next section. But we did, we had very strong partnerships with a lot of the health workers, and so we were able to collaborate with them in finding people to be part of our documentary. I will say that this was probably, as we were planning, one of the biggest uncertainties for me around the whole process was, this thought that, oh my gosh, what if, we can't find anyone who wants to be on film? And I think that our experiences doing data collection, although, these are different activities, the fact that we had such, a wonderful response to asking people to be part of our research study and to, participate in interviews and surveys really was indicative of their enthusiasm to also be part of the documentary. So that was, I would say, when we got out into the field, people were very excited to be filmed and to tell their stories, thankfully. So, that ended up not being as big of a barrier as I had worried. So next, we can think a little bit about, in the planning stages, what our story will look like. Yes, so sorry. So the story, you know, if we think about kind of the traditional, you know, a story has a beginning, a middle, and an end. Documentaries may tell many stories, and you know, so we can think through kind of how we want those to develop, with the beginning, the middle, and the end. A narrative is kind of, we think about it as the way the story is told. So this is kind of, you know, a bit of the artistry behind how this is presented and told in the final video. But you know, for the planning stages, it may be more kind of useful to think about that, you know, beginning, middle, end, the arcs of the stories. If your documentary or your video is going to be telling multiple stories, you know, you might want to think about being deliberate and intentional. So what is the purpose of this story? Is it really kind of enhancing what we want people to take away from this video? And so, you know, having a take-home message, or again, coming back to your research findings, is a really important way to kind of, you know, guide your decisions and to kind of plan out what that story might be. The target audience, this is maybe one of the most important things to kind of think through from the onset is, you know, who are you making your video for? You know, this kind of, you know, reflects the length of the video, but you know, you may have multiple target audiences. But if you're making your video for everyone, you might want to, you know, come back and think again. Are there, you know, we can think about videos made for younger or older audiences. So, you know, if you're thinking about very young ages, you might need to consider, you know, age appropriateness. You know, are the themes we're talking about going to be a good match for the, you know, maturity of the people that we're telling the story to? There are considerations here in terms of pacing, the style, where the video will live. You know, where does your target audience go to, you know, to access this type of content? Rural versus urban can become an important consideration. Certainly in Ethiopia, you know, we know that people in rural areas really are the content experts around, you know, areas of our research in terms of accessing health services. So, you know, the type of, you know, background and messaging that we provide for that audience might be quite different than urban audiences who may be less familiar, or for, you know, Canadian audiences who maybe you know, don't have that grounding in Ethiopian culture or context. And then, you know, we can think about if our target audience is researchers, you know, we might be using different types of language, different framing, talking about, you know, getting into some of the details around methodology that, you know, a general public might not care as much about, or might not resonate in the same way. And then, you know, it's important, don't forget to think about where you will show the film. So, you know, if your target audience, you know, you have to match kind of where you're going to disseminate the film, obviously, with who's going to be watching it. So in our case, we really wanted our documentary to be a kind of launching point for further discussions around our research. So the point where we made the documentary was in between kind of rolling out our research interventions and gathering the endline data. So our documentary was less about giving the final results and messages from our research study, and more about kind of you know, giving people an insight into what we were doing, and kind of an entry point to discussing down the road what our findings were, or kind of what our experiences had been doing the research. So our target audience included a few different groups. Certainly Canadians or other kind of international folks who were interested in global or African maternal, newborn, and child health issues, Ethiopians abroad. This was a way also for local communities to kind of tell and come to understand their own stories. So there was at the same time that audience of kind of local participants that we were also targeting. And we found that while our film didn't get into a lot of detail about research methodology, it kind of opened up conversation spaces for that to happen. So students or researchers that watched the film often then came with those types of questions. So moving on into budget. So this part of the documentary treatment and the planning is actually really important. It's good to have an idea up front of what your budget is and what your budget items are, so that if you are in the position where you're kind of trying to raise funds for the documentary, you can be really clear about how much you need to do the project that you need to do. It's interesting now, in current times when a lot of us have smartphones, video is something that's really accessible to everyone almost. So, to make a video, the budget can range from, very, very little to, the sky is the limit for, a very, blockbuster film. So it's good to kind of think through, what items you're going to budget for, where you want your research documentary to be on that spectrum. So in terms of the costs that we encountered, or to think about initially, in the pre-production phase, so before you even start filming, there are costs associated with insurance, permits, overhead, and administration. So these might be some of the things that you think about. A lot of the kind of more obvious costs, perhaps, are when doing the filming, so the production phase. So here there are costs associated with transportation. Are you, traveling to be at the filming site? Both in terms of maybe catching a flight from Canada to Ethiopia, but also then, going out to rural areas. You're going to be traveling on a day-to-day basis as well. Accommodation for the crew. Then there's also a lot of costs associated with, the actual kind of nuts and bolts of filming. So hard drives, memory cards. Do you need to buy any special equipment? What are going to be your costs on set? So are you providing refreshments for the crew and for the people that are, featured in the documentary? Are you using guides, translators? And are you compensating people for their time or providing appreciation gifts? Post-production, there are costs associated with editing the material, music, animation, translation, and transcription. So all of the video is going, if it's done in another language, will have to be translated to the language that the final product is in. And then also transcription. So it became really important to have kind of written transcripts of all of the footage for the editing process. And then in terms of the post-production phase, there's also costs or potential costs with dissemination events, film screenings, and marketing of the film. So these were kind of the main categories that we had thought about and budgeted for as, in the initial stages. I can assure you there were a lot of things that we didn't think of initially that kind of cropped up. So it's good to have a bit of a contingency because there will always be kind of unanticipated costs that come up. And I think the more that you're able to anticipate and plan for, the better. It is also possible sometimes that you may be able to, if you kind of run short on your budget, you may be able to raise more funds or support at later stages of the project as well. So this is really getting into kind of the nitty-gritty of the budget, but I think this is important. These were a lot of things that we learned along the way, but just in order to not kind of get blindsided by issues, you might think through, okay, who are we going to pay, how, when, and by whom? What costs are fixed and what costs are variable? So are you paying a filmmaker a flat fee for their services, or are you going to be encountering things along the additional costs along the way? Hiring experts or people with less experience definitely has an impact on the budget. Who will cover insurance and equipment costs? If you are covering crew expenses, what qualifies? So are you paying for room, board, etc., or are they covering that themselves? And then Abebe will speak a bit more to this in the next section, but if you are purchasing equipment or other kind of material goods, what will happen to them when the project finishes? Where will those items live? And then a final point, it's really useful to have a bit of cash on hand that is just easy to grab for incidentals, like in our case, batteries for the microphone, umbrellas for a rainy day, or bug spray for being out in the wilderness. So these were a few issues that budget issues that are kind of good to think through up front. And then, okay, the fun part, finding funding. So I think the most straightforward way to perhaps fund a research documentary could be just to write this into existing research funds or grants. So in the future, applying for research funding, having a plan to do a documentary and setting aside part of the research funds for that is certainly a good way to do that up front. If you are looking at external funds for this type of project, there are a number of different options. I think we pretty much tried all of these, the 5 options. So, there may be recurring funding calls. So, planning and dissemination grants or funding that is kind of specifically appropriate to something like doing a documentary. Cold calls. So this is just, approaching someone, without any kind of invitation to do so, and asking about their interest in funding a project. In our case, we were able to apply for a university scholarship. This was something that was available through the University of Ottawa. And it ended up being, an opportunity that was less widely advertised, so it was a bit less competitive. So those are sometimes good kind of spaces to look. Private or corporate sponsorship. So we did prepare a proposal for one of the companies that makes cameras, and it was ultimately unsuccessful. But that is another route that you might be able to use to find funding. And I think with this option more than the others, perhaps, it's good to think about the trade-offs. So if you are being sponsored, by a company, what are they expecting in return? Who owns the material that you're collecting, and how will it be used? And then final option could be to partner with an NGO or a local organization. And I think in terms of applying for funding, I would suggest the broader you can cast your net, obviously, the more likely you might be to secure funding. And then also don't forget about in-kind support, because that can sometimes go a long ways. So in our project, we were able to get support from Jimmy University. They covered some of our costs for accommodation and for transportation as we were doing the filming, and that really went a long ways. So in our case, we applied to first reached out to the initiative that had funded our overall research project. So this, again, was IMCHA, a collaboration between IDRC, Global Affairs Canada, and CIHR. And they were really keen on the project. And unfortunately, they were not able to give us all of the funds that we had requested, but they said that they would give us half of what we asked for if we were able to secure funding from elsewhere. So great. So our next step was we applied for a funding call from the government for a planning and dissemination grant. This particular application was, to be honest, it was a lot of work. There was a lot of detail required. And this really, prompted us to think through, all of what our timelines, budget. We had to get support letters. This was a very competitive pool of funding, and ultimately, we were not successful in getting funding, but we did benefit from, going through that application process and really thinking through and justifying every step. So, once we had done that, it was, very straightforward to pull together applications for other sources. So our next kind of attempt was through the University of Ottawa. We applied for a scholarship that was not super well known. It was available to students and faculty. It's called the Alex Trebek Innovation and Challenge Fund. And to meet the kind of requirements of this application, we added in a capacity building aspect to the project. So in addition to making the documentary, we also proposed a videography workshop for Jimmy University. And we built in part of our project to actually purchase and donate equipment to the university to support their new audiovisual program at the Institute of Health in Jima. So, so this scholarship was really oriented towards, doing kind of community building in foreign countries. So it was ended up being a good fit for us. And fortunately, we were awarded this fund. So that was enough for us to go ahead with the project. We did receive subsequently in-kind support from Jimmy University and the University of Ottawa, which was really great. And then, the trade-offs here, I would say, were only beneficial to our project. So the funders provided key connections and helped our documentary gain visibility. And they also resulted in us integrating that capacity building workshop to align with their priorities. So that was something that we were very eager to do. Okay, so moving on to talk about the key roles in videography projects. Here, as a researcher undertaking this project, it's good to kind of do a bit of introspection, think about what are your strengths, where can you contribute to the project, and where are you going to have to bring in other people. So together with our filmmaker, we kind of came up with these 3 categories of involvement in videography projects. The first being a creative role. So this is typically cinematographers, director of photography, writers, marketing, and this role really kind of drives decisions around what is going on the screen and what that will look like. Logistics are people like on-set producers, administrators, and note keepers, which actually became very important in our project to have someone who is in a dedicated way, keeping a log of where we went every day, who we spoke to, what kinds of activities we did. This was, I think, maybe one of the most useful things that happened that we came back to again and again during the post-production phase. And then finally, a third role is the kind of supporting role. So doing translation, the sound, lighting, equipment, grip. So people who are kind of helping to set up, take down, move equipment from here to there, and drivers. So, all of these roles, of course, are important, and people will have different strengths. In assembling a film crew, so once you've kind of, decided where your strengths are, what you can contribute, where you need to bring on other people, the crew itself, can be small, could, essentially be one person, or, could be quite large depending on the scale of the project. Smaller crews have the advantage of being more mobile, and potentially less expensive if you're paying them, but you may sacrifice some of the production value. Larger crews, on the flip side, are less mobile. Just you have more bodies to move around, but you may have higher production value with more hands on deck. So a few considerations here to think through. What skills do you need to bring to the project? How involved do you want to be in different stages of the project? What are your goals in terms of the production value and the impact of the film? What talent is available locally, and what will potential crew members bring with them? So the local talent was something that people or organizations that we approached for funding were really keen to have as much local involvement as possible, as were we. This was a way to ensure, to keep the budget smaller. There were fewer, obviously transportation costs than bringing people in from abroad. And although we weighed different options, we ultimately decided to hire a filmmaker from Canada. This was a little bit because we didn't have a lot of connections in this space in Ethiopia, and we just felt like there was a lot of uncertainty in terms of that. So we were able to kind of justify bringing in a Canadian filmmaker. But then we recruited all of our crew from the local area, from Juma. So in terms of the filmmaker, I was really looking for someone who would bring a lot of energy and charisma to the project. I wanted someone who could kind of bring that out in other people, the people that we were talking to. Obviously someone who was creative and willing to travel and kind of learn about the context. And I think we did find a really good fit in the person that we worked with. The crew we recruited locally, and because we had that capacity building aspect built into the research, it worked really well. We were able to kind of build that capacity and then assemble a crew from those people. So we're getting to kind of the end of this section. I wanted to touch on the gear. This was something also good to think through kind of beforehand. So who will be operating here? How much can you bring with you? Are you going to be, trekking across land? You'll be able to physically bring less with you. And then what do you really need to tell your story? So there's kind of different types of gear to think about. So when doing the filming, obviously you need something to capture video. Photo was quite important as well. So, we did still photos of all participants and a lot of, photographs of the scenery and the setup and scenes. And these have also become very important in marketing and promoting the video. Audio gear, so microphones, headphones, these types of things, and then editing gear. So in terms of the timelines, it's, if possible, try to have clear timelines and milestones for each of the stages. So in pre-production, that planning stage, that you might think about funding application deadlines, making connections, gaining permissions, or booking travel. Those were some of the key activities that we use to kind of structure that. Production is often more of a defined period. So this is kind of when you're going out to capture the video content. So here we had, in our project, we had about 2 weeks set aside for this, and we had return tickets, so that was going to be the time. And then we tried to remain as flexible as possible within that window. Post-production, this was the stage that I think can sometimes, drag on a bit. So the milestones I feel are especially important to have here. So just, having a really clear idea of, when the rough cut will be done, music, animation, subtitles, all those kind of important things that have to happen to reach that final stage. And then it was useful for us to identify points where the researchers would give feedback. So if you're working with someone who is helping out with doing the post-production, having just an agreement of, when they will give you a certain, part or stage completed, and then when you will kind of give feedback and how you'll work together. That was pretty important to think through. And then the dissemination phase, it's good to kind of have some, this might not always be immediately evident as you're planning, but as much as possible to have some ideas of, where you will share your output. Will you have to return to the funders and show them something by a certain date? And then I think this phase maybe is ongoing, but it's good to define an endpoint in terms of when you're going to use your budget and kind of just keeping your momentum going in some way. So for our project, our video was 20 minutes, and we took about 9 months start to finish, maybe a little bit longer in kind of the pre-production, just thinking through the idea. But we spent about 3 months, making our treatment, making all of the plans, hiring a filmmaker, arranging travel and equipment, planning the workshops. And then we were in the country for 2 weeks on location, doing the interviews, meeting with the researchers and all of the stuff on the ground. The post-production was around 2-3 months, where I was working quite closely with the filmmaker on the editing, refining the story, pulling things together, the final checks, and then our dissemination. This was a little bit impacted by the pandemic, but it was originally planned to be about 3 to 4 months that we would really do a dedicated effort in terms of disseminating the product. And then after this, there have been a few more opportunities that have emerged that we've engaged with. So just wrapping up this section, I wanted to make sure that I didn't miss kind of other miscellaneous issues. So so the consent to participate. This is a clear distinction from, we had this question a lot, do you have to get ethics for the video documentary? The short answer is no. If the documentary is used as kind of a media project, it is not research as such. So we didn't have that informed consent process, but we did have something analogous where we would ask everyone to sign media releases. So we would talk to them about, what kind, similar to informed consent, what kind of information we'd be talking about, how that would be used. And so we asked them to sign that. Appreciation gifts. So good to think through, if you are going to provide some type of compensation, what is culturally appropriate and commensurate with their contribution. So in our case, in speaking with mothers, we did bring some, baby clothes and that type of thing to use for gifts. We got a bit of feedback that, they maybe would have just preferred to have cash, so we switched to doing that. The weather and environment, of course, are a big factor. So while we would love to have, sunny skies and bright lighting for a lot of our outdoor shoots, that wasn't always the case. So, as much as possible, trying to anticipate kind of how to plan around that is good. I already mentioned the logbook, but keeping a note of key information, such as people's names, the spelling of their names, is really important. Even the people who contributed on the crew, that was something that we needed later on to make the credits for our video. So as much as possible, keeping that information up to date and in one place really helps out later on. Avoiding brands or logos while filming. So, people that have branded clothing, it's good to not have that show on camera if possible. And then another preparation that we did before we went out into the field was to pull together just a preliminary first aid kit. So, if we did run into issues, that we would be able to provide a bit of care. And this was really important just because we were going out into the field. As a baby, we'll talk about it in a minute. We did some pretty intense, treks and physical activity associated with the filming. So, so that's the pre-production module. I do want to pause now just to give opportunity for any questions or comments that participants may have. Please feel free to unmute and chime in if you would like to ask a question. There's also the live Q&A feature in the portal that you're welcome to use as well. All right, so I'm going to turn it over now to Abebe, who's going to take you through the second module about production. Are you with us, Abebe? Julia, are you able to see if a baby is connected? Okay, I know we were having some issues with internet connectivity. I'm just gonna check here. Okay, so he's not on. So I'm going to proceed with the next section. If a baby does manage to connect, I know they were having some issues with the internet in Jima. If he is able to connect, I will turn it over to him. The second module is addresses kind of the phase of going out into the field and doing the filming as such. So here we're going to cover the videography workshops, the workshops that we gave to build capacity at the university and to train individuals who would then become part of the filming crew. We'll go through some of the equipment that we used, a typical day in the field, and then some of our insights about interviewing. And these really came from a baby. So our project, as it developed, really had three components. So we had, capacity building workshops that we held at Jim University. We had our second component was to purchase and donate equipment to the audiovisual program at the Institute of Health at Jim University. And then the third component was to actually film and produce the 20-minute documentary. So the workshops that we did, we extended an invitation to students and staff from 8 different departments at Jim University. And we had a really good response. We had about 40 students and staff that joined our workshops. They were held over 2 days, and our goal here was to build capacity for documentary making and for videography, and also to ensure that there was sustainability for the project, so that the equipment that we left behind at Jim University would then continue to be used for subsequent projects. The workshops were delivered by myself and our filmmaker, Nicholas Castell. And this, I think, was a pretty unique opportunity. I, kind of was able to weigh in with a lot of the researcher perspective, and Nicholas had all of the hands-on expertise in terms of filmmaking. He was, very keen to help develop the content of the workshops, and he loved teaching. So we were able to really, I think, have a fun time over the 2 days. The workshop had a very participatory, hands-on kind of approach. We did a lot of group work, a lot of activities. The first day of the workshop, we were mostly in the classroom, so talking about kind of a lot of the pre-production considerations and doing some exercises around that. And then the second day was mostly hands-on. So we, kind of taught the participants how to use a lot of the equipment that we had brought with us. They then went out and, did some filming on campus, and kind of got that experience just using the equipment. At the end of the workshop, the participants could then volunteer to sign up as part of our crew. So following the 2-day workshops, we then went out into the field, and we were able to bring 2 or 3 of the workshop participants with us each day to help out kind of with the filming on the ground. In terms of the equipment, we purchased the equipment in Canada and brought it over to the university. I should say before that, that our filmmaker used his own professional gear for for the filming of the documentary. But then this donated equipment was used by the students and staff at the university to kind of do some supplementary filming, to take pictures, and they got a really good sense of how to use the equipment and could kind of get experience with the professional filmmaker alongside. So the equipment that we donated, we designed kind of 3 different videography kits. The first kit worked with a cell phone, so it was a piece of equipment that was a stabilizer so that you could hook your cell phone on and take video that way. Our second videography kit was a small handheld camcorder, and then the third was a DSLR camera that could do still photos and video. Other equipment that we brought over to donate included mics, memory cards, tripods, cases, a laptop computer, and we installed a software program on there for editing. So we determined these kind of needs in conjunction with our research colleagues at Jimmy University, and brought this equipment over from Canada. So as I mentioned, the workshop component really gave the students and staff at the university a good intro into how to use the gear. They had the opportunity to do field work initially at Jimmy University, some filming on campus, and then they came out with us to the filming sites in the rural areas. Kind of going into this project, my colleague Abebe did a lot of the on-screen interviews for the documentary. And we were experienced data collectors, especially Abebe has done a lot of this. But doing the interviews for the documentary were a little bit different than doing research interviews. Abebe would talk with people to get their personal stories and their personal accounts. But because we were filming this, and we really wanted people to feel at ease, to be charismatic, to kind of be expressive on film. And so that was kind of one of the ways that these interviews differed from research interviews. Typically, before we went out to film, we would prepare a series of questions in advance or talking points to go through with the characters of our documentary. And sometimes this would kind of have to be done on the fly. So if we had planned to go out and talk with a pregnant woman, it might be that we met someone on the road who had, an interesting story to tell. So we would have to, come up with some questions or some talking points to ask them about on the fly. In terms of interviewing, gaining access to storytellers was something that we had to navigate as we went. Fortunately, I think everyone we talked to was really excited to be filmed, really wanted to be part of the documentary, so we didn't really have any obstacles there. But there were some cases where a lot of people wanted to participate, and we didn't have time to talk to all of them. So it was, sometimes there was almost too much access that then we could handle. And then translating as we go. So our interviews, Abebe did most of the interviews with people that we filmed. And he did those interviews in the local language. And it kind of became, he would do the interviews, then he would come back and kind of give us a brief about what they talked about in English. And then we would, kind of say, okay, did this come up? Can you go back and ask about that? So, it was this kind of translating as we go dynamic that emerged. So a typical day in the field, so going out to film, We usually would meet at the university in the morning. Myself, the filmmaker Nicholas here, members of our research team who had different roles in doing the interviews or helping with the logistics, and then a couple of the people from our workshop who would assist also in taking some of the auxiliary footage and helping just to kind of organize the events. So heading out from the university, normally we would do a bit of a briefing while we were in the vehicle, heading out of the city, where we're going today, who we're talking to, kind of what our plan was. This usually kind of wrapped up around the time that we started to get to some of the rural areas. The roads are very bumpy, so at some point it became less comfortable to be talking. So we would kind of hunker down until we got to the site that we were going to, and we normally had someone in the community that was expecting us. So often this was a community health worker and a health extension worker, someone, a midwife or the director at a primary healthcare unit, someone who knew we were coming and had kind of, helped us to find someone in the field, or, would help us to find a participant. This, community connection would typically accompany us as we went to the community. And, going out into the field was a combination of, driving and walking and, sometimes traversing streams and rivers to kind of get to, we wanted to reach women and to interview women for the documentary who face these types of barriers in accessing health services. So often we had, we would want to go to them to talk to them. So in a few cases, we found a kind of local person to guide us to the participant. Sometimes the health worker or someone would accompany our team. And then, once we had reached the home of the person that we wanted to speak to that day, we would typically ask them, explain what we were doing, ask for their willingness to participate. Fortunately, they always said yes. And then, often after we had talked to that person and taken some video from their surroundings, we would then encounter other people that we were interested in talking to. So this is everyone from, husbands or other family members to religious leaders. There was one place we found a group of old men kind of sitting on a bench, and we asked to talk to them, and they were happy to give us their thoughts on the subject. So, it was a lot of kind of making arrangements on the fly. So after we had done some of that, some of those interviews and got some footage of, their living conditions and their homes, the community, typically one of the last activities that we would do is to get footage from our drone. So Nicholas had brought with him a drone, which would fly up 200-300 meters in the air and get this amazing footage of the landscape and the community. And this was really brought a lot of attention to us. This was something that most of the people had never seen before. It was really exciting. And so this was typically a large crowd would gather and be interested, what's going on, what are you doing? So we ended up saving this to the end, just as something we could do after kind of we had gathered what we needed to do, or other things we had needed to do. So here, just going back to the first part of the presentation today, the documentary treatment was really important, just to guide our filming, to make sure that we had got the images that we wanted to get, that we were capturing the types of stories that we wanted. going out into the field was a really intense time. It took a lot of energy, and so having that document just to be able to check off, like, yes, we've talked to a health worker, we've talked to a woman, we have footage of this, we have footage of that. It was really useful to have that to kind of guide us and remind us. It was a lot of fun going out into the field. It was just a lot of seeing people's homes, learning about people's lives. We had a great time, but it was a very physically demanding, in our case, physically demanding kind of tasks that we were doing. So at the same time, it was quite tiring. We did about 6 days of going out to remote areas to do the filming, and then we did subsequent kind of days interspersed with that, doing some filming around the university, interviews with researchers and with colleagues from the zonal health department. And to be honest, those 2 weeks went by really quickly. So there was one kind of memorable experience. One day we had trekked out kind of up a hill to talk to a woman who was about 8 months pregnant, and her husband. They kind of did a coffee ceremony for us. We were able to interview them both about their plans for the upcoming birth. We got a shot of them kind of walking through their village with the drone, and then it just happened that there was kind of a group of imams that were having a religious ceremony, and so this was the ceremony was not something that women were able to attend, but they were okay with us taking a bit of video of this. So a baby. I wish he was here to describe it, but he said it was really something incredible to be part of this. He was able to go in and to speak with several of these religious leaders, and to see kind of their prayer rituals, and to also talk with them a bit about maternal and child health and pregnancy, and how they would guide the community in that way. So this was kind of something that was unexpected, that we encountered while doing the filming. There are just so many stories and interesting things that happened while we were out in the field. So the use of the drones was definitely a novelty, a good way to bring a smile to the faces. People would just erupt with laughter when they saw these strange machines flying over the community, and it was a good way to really build rapport with the community. The response rate that we had was better than expected. We had 100% of people agree to be part of the documentary that we approached, which was like a relief for us going in. There was, a lot of community engagement. Everyone wanted to see what was going on. It was not always possible to film everyone, but we tried to, engage people and let them know what we were doing. There was one location that we went to where it was market day, and we thought, this is great. We can film the local market. It will be a great way to kind of show this area. But we found that when the filmmaker walked through the market with his camera, everyone just stopped what they were doing and stared at him. And so he said that the footage was really funny, because it was all these people just silently looking at him as he walked past, and it wasn't kind of the organic market experience that we wanted to show on video. So there was sometimes this everyone wanted to see what was going on. We used, at some point, we wanted to find women who had used maternity waiting homes to talk about their decision and their experience being at the home. So one technique that we used was we actually went to the maternity waiting homes with the health workers and looked through the logbook of women who had been there, and then kind of traced back to their homes. So so this entailed a lot of traveling to remote areas, trekking through, down paths, kind of to find, women who had used the facilities and to ask them for their stories. And then I'm going to keep saying this, keeping records was really important. So we had written records, including a daily log that we kept just to record all of those details that are, so important to just, miss as you go. And then we also did a lot of visual and auditory archiving as we went. So this included still photos of everyone we talked to, a lot of still photos also of people we didn't talk to. And we have used those photos way more than I anticipated at the time. So, as we'll talk about in the next section, the video has been covered in, different media outlets. We've made posters for video screenings, and having those still images were really important to provide for those opportunities. And then, a lot of B-roll. So, taking pictures or taking video as we were driving, filming some of the, coffee making ceremonies and things that can just, fill in spots just to show the context, to fill in the video. Finally, here, this shows a photo of some of the equipment that was donated to the department at the University of Jimma. The AV program there is going to be able to use this and is using this for subsequent projects. And the idea was that all of this videography equipment, we now have 40-some people who are trained and experienced using it. So they'll be able to bring forward, to train other people, and to use it, for other research uses at the university. So I'm going to pause here for a moment. Were there any questions or comments before we move on to the final section? Okay. I'm just looking at the live Q&A. I don't see anything. We have a few people who've introduced themselves. Thank you. On the discussion forum, please feel welcome to continue to do that. So I'm going to move on to the third module, which is speaks to kind of everything that happens after the filming, in the editing process, and then the dissemination part. So the post-production process really starts actually during the production, or during that filming stage. Starts right after day one of filming. So here we kind of went with this idea of having triple redundant backups. So every day after we got back from filming, as tired as we were, we would copy all of the material onto an external hard drive and to another place, so that we were not at risk of losing all of this great footage that we had taken. And then traveling back to Canada from Ethiopia, we left a copy of all of the footage and pictures and audio, one copy at Jimmy University. Nicholas traveled with a copy, and I traveled with a copy. So we were really sure that we had all bases covered, that we were not going to lose any of that material. The next stage was to do a bit of a rough cut, just to get the structure of the documentary down. For those of you joining, we ended up doing a 20-minute video documentary. So just getting kind of the rough overview of pieces in place, was kind of the first stage. And Nicholas, our filmmaker, took the lead on this, but we met at each stage to have input and to kind of talk to, create a common vision for how, for where we were going with the documentary. The rough cut stage also entailed making transcripts of all of the interviews and in some cases doing translations. There are a lot of great tools available online to do that, sometimes with accents, some has to be done manually. But we were able to get that. The next step was to beautify, so to go through and take care of all those little details in really making the film look great. And then we reviewed, a number of us from the research team went through the documentary and just, made sure that it was ready to go, gave any kind of final small bits of feedback. And then the next stage is, of course, the dissemination. So releasing the documentary, speaking, at events or conferences, and showing it to our target audiences. So this slide actually comes from the filmmaker. He developed kind of a list of do's and don'ts in terms of creating the sequence in the editing process. So he talks about things like creating hooks, rearranging facts, showing behind the scenes, and advises against, changing facts, the pacing being too slow or making things over dramatic. So those were kind of some of his guiding principles in editing the film. This is a picture of a musician that we worked with here in Ottawa, and he actually made music to accompany the film while watching the footage. It was just a perfect match with kind of the tone and the pacing of the speaking and the film. And we're going to watch in a couple minutes a 2-minute clip. And so you'll be able to hear some of his music that is featured on that. We also, going back to the idea of using local talent. This was a member of our research team in Jimma who kind of rewrote a folk song, traditional folk song from Ethiopia, to address some of the safe motherhood issues that we had explored in our research. So he performed kind of spoken word, kind of poetry with accompaniment, and we were able to incorporate that also into the final product. So here are a few questions just to ask as a researcher collaborating with a filmmaker. So thinking through how hands-on do you want to be? Your role as a researcher could include revisiting the treatment together, especially the story during this post-production phase, to just make sure that things stay on track, that you're staying true to your research findings, and always keeping in mind your target audience and your desired impact. So one opportunity that came up during our research project, there was a large conference in Vancouver in June 2019 called Women Deliver. And we were able to show part of our video. We created a 2-minute teaser to show at this conference as a way to kind of gain visibility for our project. This 2-minute teaser was actually done before the full documentary was completed in the post-production phase. So it kind of gave people a little taste, a little anticipation for what was coming. And I thought that, Julie, if you are there, I'll just ask you to queue up this. I thought we could just watch this so you can can get a sense of, one of the outputs from this project.
In our community, Jimma community, pregnant women became pregnant not only based on their needs, based on the influence of their families, their husband initially, primarily, family, then other community members influenced on that. In most areas, it's not planned. It's out of their needs.
On the State Motherhood project, we are doing two intervention projects. One is developing maternal waiting area. The other is information, education, communication. Now we are working in the community, in the local level, for the purpose of reducing the maternal mortality and home delivery. That means we are ensuring the health of the mothers. That means the health of the community. So we are working in Jimma zone, 3 districts. In Goma, Sakaj, and Kasa. There is a big relationship between supporting the government here in local area and closing the gap with the policy.
Actually, data talks. If you analyze, interpret, data talks. So from this project, we learned how to capture data from the community, especially from the community. There are so many research areas, so they should be translated into knowledge.
The videography component, I think, is very innovative. It's going to be a very valuable way for us to show some of the situations that we've encountered that are hard to express through written text or through policy briefs. All in all, I think it's been a very rich experience for everyone involved.
Great, thank you. So that was the 2-minute teaser that we created and showed at this conference. Professor Marankar, who was meant to be on the presentation today but could not because of internet connectivity issues, was going to speak a bit more about his experience being at this conference and showing the video. But I want to leave a bit of time for questions. So I'm going to kind of go through the next few slides. So these speak to different venues where we have shown our final 20-minute documentary. So our kind of initial, or our main premiere was in Ottawa in 2019. So we showed, we timed this launch of our documentary at a time when our colleagues from Jimma University were in town for a conference. So we organized in partnership with the University of Ottawa, Michel Jean Center for Global and Community Engagement. We organized this evening event on campus. We had a few guest speakers and showed the documentary, and then had a panel discussion with the filmmakers and researchers. And so, this was really a great way for us to, show our work, to introduce some of these issues that we had been researching to the university community and the community of people in Ottawa. And from this screening, we really were able to get a lot of really great connections. We received some feedback, and it led us to new opportunities as well. So from this, we were invited to show the documentary to a group of Ethiopians in Canada at an Ethiopian restaurant here in Ottawa. We were invited to show it at a women's empowerment brunch hosted by an NGO who works in Ethiopia. And we've also shown the documentary at various conferences. There have been some delays in terms of showing the documentary in Ethiopia, but it will be part of our research project knowledge dissemination and translation strategy. So next week we are holding the National Advisory Committee meeting with some of the high-level decision makers in Addis. And so we'll be showing the documentary to this group, as well as there's a screening planned at Jimmy University. And when possible, we are hoping to go back to the communities where we filmed the documentary and to show them the final product. Other coverage briefly. So one of the bits of funding that we received was from the Alex Trebek Innovation and Challenge Fund. And so, having different kind of funders contribute to the documentary has provided opportunities and channels for us to partner with those funders to show the documentary and get coverage in other places where we might not have otherwise. So we've had some opportunities last year to meet with Alex Trebek while he was in Ottawa. He is an alumni of the University of Ottawa, and so there were some opportunities there to talk about the film with a larger audience. And then, the University of Ottawa website has also featured this project. So we do have a few minutes now for questions. These are some of the key insights, which kind of summarize things that we've talked about over the last couple hours. I am keeping an eye on the live Q&A part. If you do have questions, feel free to type them in there, or I believe you can raise your hand, and we're happy to take those or any comments that you might have. While we're waiting for that, I'll just run through these key insights as a means of concluding. So our first insight in terms of documentary making about research projects is that strong partnerships are really key within the local environment, but also with filmmakers and funders. And this is maybe one of the most important things to stress is, having those partnerships is really going to serve you at all stages of making and disseminating a documentary. Sustainability was a guiding principle, so we were able to do a lot of local training and to leave some equipment behind that students and staff at the university knew how to use, and that kind of ensures that this videography and documentary making projects can continue in that environment. Similarly, we really wanted to build capacity as we went. So we were constantly, we held these workshops to train the crew, and then there was kind of ongoing training in the field. And, we all learned from each other as we went, because we all brought kind of different strengths and experiences to the project. We found it was really useful to be thinking about the dissemination strategy right from the start. So, thinking about where will the final product live? Are you going to be putting your documentary online? Will it live on social media? Will it be something that, is brought out for, special events or screenings? Redundant backups and archives was important to ensure that things weren't missed. And then, being adaptable and flexible was always a good approach, just to be able to adapt to changing circumstances. So I'm going to leave you today with the link to our video and the teaser. They are both posted online. They're freely available, so I would invite you to check those out. Also, I will draw your attention in the handout slide, in the handouts part of the portal. There is a handout to that documentary treatment page. So if you are interested in using that or adapting that to your own needs, you're more than welcome to do so. I would also really welcome, drop me a note. I would be happy to engage with any of you with further questions, or to learn about your experiences as well. This has been, a really enriching part of our research project, to capture some of these things on film. And thank you to you all for being here and attending this session.